Cast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Thank you for joining us today. This is the webinar for the Department of Family and Support Services, Senior Services. And this is the range of programs that we have that are going out for RFP, including the Intensive Case Advocacy and Support, ICAS program for vulnerable older adults, Case Advocacy and Support, which is CAS for vulnerable older adults, and home delivered meals. Our release date is May 3rd, 2021, and the due date is June 17th, 2021. Thank you for joining us today. Now, due to the high volume of participants, everyone has been placed on mute. And please submit your questions via the question box. And we will respond to the questions after going through the slides. Okay, so if you look over to the little dashboard on the GoToWebinar tool, you'll see a place to go ahead and put your questions in, and also a chat. And there's a little arrow, and if you press on the arrow, it will put everything out, and you can choose to send it privately or not. So you can also use the question box to notify us of any technical issues. For example, I assume that everyone can hear me okay because no one has said otherwise. If in fact you are having difficulties, please do let us know. So first of all, next slide, please. I'd like to thank you for joining us today and welcome you. My name is Karen Cobb-Flute. I am a manager of senior services, and I work in our in-home portfolio. I am delighted to be joined today by two of my colleagues, Lisa Mani, who oversees our legal services under portfolio, under aging, and then also Nikki Protas, who oversees our home delivered meal and congregate meal programs, two crucial programs for the well-being of older adults. I'm also joined today by my colleague, Julia Talbot, who is our resident expert in all things related to RFPs and applications and so on. So she will be our guide through the second half of our presentation today. And our first part will start with a brief overview of DFSS and the strategic framework, which we've embraced. We'll talk briefly about senior services, and we'll talk about our program models. And then Julie will take over and guide us on the more technical aspects of your application. And spoiler alert, she is going to tell you to save frequently and save all the time as you do your application. Now, if we go to the next slide, DFSS mission is to work with community partners. We connect Chicago residents and families to resources that build our stability, support their well-being, and empower them to thrive. And you can see our priorities here are to deliver and support high quality, innovative, and comprehensive services, to collaborate with our community partners, sister agencies, and public officials on programs and policies that improve Chicagoans' lives and really advance systemic change, to inform the public of resources available to them through DFSS and our partners, and importantly, to steward the DFSS resources responsibly and effectively. Today, as we mentioned, next slide, please, we're going to be talking about our programs that fall under the senior services portfolio. Now, before we go there, next slide, please. Let's spend a little bit of time talking about our strategic framework. And this is one of our goals is to achieve better results for vulnerable Chicagoans through this strategic framework, which really incorporates improvements scaffolded over time. So you can see we start in phase one on the bottom with our strategic framework. We set and operationalize department priorities, goals, and metrics, and align them with our decision-making procedures. We then have strategic contracting. We engage with our grantees to integrate outcome goals and metrics into results-driven RFPs, or requests for proposals and contracts. We then focus on performance improvement, where we implement a system to prioritize and execute efforts and improve results. And then phase 4, system coordination, and that's improving data service, matching and referral and linking data to improve client experience and outcomes. Now we see, next slide please, RFPs as critical strategic tools for embracing our strategic framework. So we want to ensure that our outcomes continue to be at the center of our work, that we develop a shared understanding of the priorities for and how we will track improvement, and that we support a bidirectional or two-way communication between DFSS and our delegates about best practices, high-quality services, and the needs of those who we serve. And so you may see in this presentation, and as you've looked over the RFP, we've adjusted the structure and content of our RFPs and application questions to really shift the focus from the activities that happen to our goals, to align DFSS priorities with the selection criteria and application questions, and finally to pose questions that provide the most relevant information for decision making. Next slide. At DFSS RFPs articulate what we want to achieve together for Chicagoans rather than focusing on the activities alone. So we want to look at the outcome goals. What are we trying to achieve with the RFP? What's our target population? Who do we want to achieve it for? What is the context? Where are we today and what are our priorities for the future of the programs? What can we build on? Where are challenges? And how do we map the landscape? What are the program requirements? The most important programmatic activities that our delegate agencies should undertake. And finally, to be very clear with performance measures, how we'll measure success and progress against outcome goals and work together to improve. Next slide, please. DFSS selection criteria reflect our focus on results and best practices. So again, there are 4 different selection criteria categories: the strength of the proposed program, the performance management and outcomes. So we'll be looking at past performance and that you're capable of collecting and using that data to manage the performance. That the organization has the organizational capacity to fulfill the RFP. And finally, the reasonable cost, budget justification, and leverage of funds are utilized in the administration of the RFP. We are looking for fiscally sound applicants that have reasonably estimated the costs and can leverage their other non-city funding for the program. Given events over the past year, we've reviewed all of our RFPs to integrate a greater focus on equity and lessons learned about service delivery during the COVID-19 pandemic. And we're really working to focus more clearly and describe program expectations and priorities for improvement. Next slide, please. Now, as I mentioned, we're working with the senior portfolio today, and you'll see that this is some of the programs that we do, and this is where we're nestled within the 7 divisions of the Department of Family Support Services. And of course, we have our very large and very successful home delivered meals program, our caregiving programs, the supports for in-home care that help people to remain independent and living in the community as long as possible, and information and benefits. We also have, of course, our senior centers and our service providers and delegate agencies. Next slide, please. And with that, I will invite my colleague, Lisa Mani, to go ahead and talk about case advocacy and support. Go ahead, Lisa.
Thank you, Karen. Good afternoon, everyone. Thank you for joining us today for today's webinar to learn more about some of the senior services that we offer. Under my portfolio, I do oversee the CAS and ICAS program, of which I will be going over the RFP with you today. I'll start by discussing the purpose of the CAS RFP. The CAS Advocacy and Support, CAS, for Vulnerable Older Adults program provides face-to-face well-being checks that verify, assess, and address the needs of vulnerable Chicagoans 55 years of age and older who are reported as being at risk and may be experiencing decline or have a presenting situation that impedes their ability to continue to live safely in their homes. Next slide, please. To provide you a little background, according to AARP, by 2030, 1 in every 5 Americans, 70 million, will be over the age of 65. The fastest growing segment are individuals 85 years of age and older who are increasingly frail, diverse, and have growing economic and social needs. Additionally, nearly 90% of people over age 65 want to stay in their home for as long as possible, and 80% of older adults believe their current residence is where they will always live. It may be difficult for older adults to safely age in place, as many have limited support networks available to them or are reluctant to accept needed services, thus increasing their exposure to vulnerability and risk. Next slide, please. Case Advocacy and Support for Vulnerable Older Adults, CAS, helps at-risk older adults address an urgent situation that impedes their ability to continue to live safely in their homes. The CAS program is a transitional service between an individual or agency that reports an older adult in need and other more formal or informal supports that assist the older adult with need. The CAS program staff provides a timely response to calls of concern, assess client needs, and address the need by mobilizing community resources. Next slide, please. Our goals. The goals of the CAS program include starting the first phase of the process in assisting older adults to reduce or mitigate the urgent need that is causing their inability to live safely, improve the physical or environmental situation, and increase their well-being. Next slide, please. Our target population. The CAS program seeks to assist Chicagoans 55 years of age and older who are suspected of having triggers of decline that put them at risk of losing the continued ability to live safely at home without needed supports. Any situation that puts a vulnerable older adult at risk can trigger a service request. In general, triggers are events or later life changes in the physical, cognitive, or mental health of otherwise healthy older adults living in the community that can lead to frailty, limit older adults' daily activities, and ultimately result in the loss of independence. Next slide, please. Characteristics of at-risk or vulnerable older adults exhibiting triggers of decline include but are not limited to living environment. For example, as animal hoarding to the degree it affects safety. Home requires significant repair with safety hazards. For example, exposed wiring, inadequate roofing to provide protection from the elements, infestation of insects, rodents, or other pests. Physical functioning, body odor, unkept and or inappropriate four-season or soiled clothing, difficulty seeing, speaking, hearing, or moving around, leaving home, inability to manage medications. Next slide, please. Cognitive decline. Cognitive impairment. Forgets recent events, repeats the same questions and the same stories, forgets the name of close friends and family members, forgets appointments or planned events, forgets conversations, misplaces items often, diminished executive function, has difficulty understanding written or oral spoken to information, exhibiting signs of confusion and or cognitive impairment. social-emotional supports, caregiver duress or inability to provide support, lacks involved family members or friends, needs home care assistance and does not have a paid caregiver, reports being alone and has feelings of loneliness. Next slide, please. For this RFP, DFSS is seeking proposals to provide all the core program components listed below. Referral process. The Information and Assistance, the INA call center, receives requests from well-being checks from a variety of sources, including, but not limited to, 311, automatic offices, police, fire, and building departments, City of Chicago infrastructure departments, animal control, and many others. Excuse me. Requests for well-being checks are all reported to DFSS Senior Services, which creates and forwards the corresponding service request to the CAS provider, which would be you, to complete a well-being assessment of the older adult within 24 hours on business days. The CAS provider is expected to have CAS staff assigned to the CAS program during business hours 5 days a week. Next slide, please. Conduct a well-being assessment. The CAS team is responsible for conducting a well-being assessment to verify, access, and make recommendations to address the situation of the at-risk older adult. Refusals. If the senior refuses an assessment and demonstrates capacity, the case record should clearly document that reasonable steps were taken and appropriate in all circumstances. After the well-being check. After the CAS provider completes the ECM, DFSS Senior Services will review the assessment and case record, including the CAS provider's follow-up recommendation to determine if additional referrals should be made. Next slide, please. The performance goals and outcomes. To track progress towards achieving the outcome goals of this program and assess success, DFSS will monitor a set of performance indicators that may include, but not limited to, 80% of first visits, CAS assessments, will take place within 24 hours on business days, up to 3 visits and 72 hours excluding weekends. 100% of client activity will be documented in ECM within 24 hours of interaction. 100% of clients who need services will be directly referred to INA and/or referred to DFSS Program Manager for further services. Note, this section matches the broad goals at the beginning. This is about outcomes to the client. Broad goals, outcomes are typically represented in percentages. Next slide, please. Additional performance goals and outcomes that we'll be tracking. To assess progress towards the above performance indicators, DFSS also intends to track output matrix that may include, but are not limited to, the following CAS team activities: number of open cases, number of assessments made, number of referrals to APS, number of referrals to CCUs, number of referrals to DFSS, number of referrals to INA, number of visits conducted during emergency events, during the winter time, heat related, number of cases closed. It is expected that 100% of output matrix will be achieved regardless of target number of clients. Next slide, please. The selection criteria, the strength of the proposed program. The respondent clearly defines services to be provided that are appropriate to addressing needs of and achieving desired outcomes for the target population. The respondent's proposed program is supported by a strong national or local evidence base and/or aligns with best practices for older adult engagement in crisis management. The respondent demonstrates a clear understanding of the target population and their needs and challenges. The respondent has an effective approach for engaging all clients referred to the agency through the CAS Advocacy and Support Program. The respondent demonstrates strong partnerships and coordination efforts with other community-based resources that can leverage to serve the target population. Next slide, please. The selection criteria. This is in regards to program performance, outcomes, and qualities that we're looking for. The respondent has the relevant systems and processes needed to track and report performance on program outcomes. The respondent has experience using data to inform, improve its services or practices. The respondent has the relevant systems and processes needed to collect and store key participant and performance data. Next slide, please. The selection criteria, organizational capacity. The respondent has qualified staff responsible for program oversight and supervision. The respondent has adequate systems and processes to support monitoring program expenditures and fiscal controls. The respondent has adequate human resources capacity to hire and manage staff. The respondent has presented a reasonable cost proposal with justification for program cost. The respondent's organization reflects and engages the diverse people of the community it serves. The respondent has a sound staffing plan that addresses unforeseen staff shortages for direct service staff to avoid service interruption to clients. Next slide, please. The selection criteria we're looking for as it relates to reasonable cost, budget justification, and leverage of funds. The respondent has the fiscal capacity to implement the proposed program. The respondent leverages other funds and in-kind contributions to support total program and administrative cost. For example, state, federal, foundation, corporate, or individual donations. The respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. The attachments that should be attached in submitting your RFP: liability insurance, board member identification, SAM certificate, certificate of good standing, the bylaws and articles of incorporation, financial statement, RIS determination letter, budget forms, resumes and/or job description for staff administering the CAS program, CDBG compliance acknowledgement, City of Chicago compliance acknowledgement, and conflict of interest. Next slide, please. Now we're going to shift gears and we're going to discuss the ICAS RFP. This is a totally separate RFP, a totally separate program with different requirements. The Intensive Case Advocacy and Support ICAS for Vulnerable Adults program supports highly vulnerable older adults to live independently in their homes and communities for as long as possible. ICAS is implemented by addressing self-neglect, home safety issues, and other barriers that make aging in community difficult, to mitigate future risks and defer residential placement as appropriate. Next slide, please. The purpose of the ICAS RFP. The ICAS program responds to older adults in need by assessing risks, engaging in relationship building and care, while working with the individual to create an intervention plan that includes the coordination of services and programming that improves upon the individual's current living situation. Next slide, please. Some background about ICAS. According to the 2018 American Community Survey, approximately 49% of the 465,426 seniors ages 60 and above in Chicago are living alone, including 39,250 ages 85 and above. Many older adults live independently without assistance. However, some older adults lack the ability to maintain their own safety due to physical or mental health issues and may fall into a state of self-neglect. This program supports those in the greatest social and economic need, those that may be at risk to themselves and those that may lack the capacity to manage their own care and safety without assistance. Support services offered. Support offered by the ICAS program may include frequent check-ins by ICAS agency staff and assistance securing services such as heavy-duty chore services, home-delivered meals, homemaker services, caregiver support, Social Security benefits, Medicare and legal services, and any other assistance as needed. These are just a few of the program areas that you will be expected to collaborate with, to work with, to make sure that the senior has what they need. Next slide, please. The goals. By the end of the ICAS intervention, as informed by the completed assessment and individualized care plan, the client will show improved well-being and an improvement in their situation, even if the issue has not been completely resolved. This may be achieved by the following actions, including but not limited to regular visits with ICAS providers to address issues identified, implementing a care plan developed with client and monitored for progress as shared and discussed with DFSS staff during monthly case management meetings, establishing, building, and maintaining the client relationship as evidenced by chart notes and client-provider encounters, creation and convening of multidisciplinary teams with relevant partners to address challenging cases and collaborate on client care and oversight. We are moving to a more results-oriented approach, opposed to just trying to get as many numbers, as many clients as possible. We're trying to make sure that the clients are better off. That's our primary focus. Next slide, please. There will be 8 ICAS community regions. DFSS seeks to provide services through delegate agencies in 8 regional community areas across the city. I'll go through these pretty quickly because I want to show you a map so that you'll have a visual. But the first region will incorporate Edgewater, Lincoln Square, Rogers Park, Uptown, West Ridge. Region 2 will incorporate Albany Park, Dunning, Edison Park, Forest Forest Glen, Irving Park, Jefferson Park, North Park, Norwood Park, O'Hara, Portage Park. Region 3 would incorporate Lakeview, Lincoln Park, Logan Square, The Loop, near North Side, near South Side, near West Side, North Center, and West Town. Region 4, Austin, Avondale, Belmont Cragen, East Garfield Park, Hermosa, Humboldt Park, Montclair, North Lawndale, South Lawndale, West Garfield Park. Next slide, please. Region 5 will incorporate Archer Heights, Armour Square, Bridgeport, Brighton Park, Clearing, Douglas, Fuller Park, Gage Park, Garfield Ridge, Grand Boulevard, Hyde Park, Kenwood, Lower West Side, McKinley Park, New City, Oakland, Washington Park, and West Elston. Region 6, Chicago Lawn, Inglewood, Greater Grand Crossing, West Inglewood, West Lawn, and Woodlawn. Region 7, Ashburn, Auburn, Gresham, Avalon Park, Beverly, Burnside, Calumet Heights, Chatham, Mount Greenwood, South Chicago, South Shore, Washington Heights. And Region 8, East Side, Hegwood, Morgan Park, Pullman, Riverdale, Roseland, South Daring, and West Pullman. Next slide, please. This is the map of the 8 regions. So you could take a look at it, and it is in your RFP. This should provide you with a visual in terms of the different regions of which you can apply. You can submit more than one region that you would like to apply for. We'll leave that to your discretion, but I do encourage you to apply. Next slide, please. The target population. ICAS targets highly vulnerable older adults age 55 and above who are often in greatest social and economic need, living alone in a state of self-neglect, at risk to themselves or others, or who have difficulty in managing their own care and safety. The Older Americans Act specifies that services be targeted to older individuals with greatest economic need, with greatest social need, at risk for institutional placement, with limited English proficiency, and low-income older individuals. This may include subpopulations who, due to language, culture, gender, sexual orientation, ethnic, or declining cognition, need targeted services. Respondents will position their applications for a specific regional community area. Next slide, please. The program requirements. The ICAS program is comprised of the following components. Assessment. The ICAS agency will conduct visits, document findings, assess, interview, and obtain the client's understanding, research background, establish the facts, and regularly visit the client. Planning. The purpose of the planning portion of the ICAS program model is to determine which services will resolve the problem and help establish and maintain the referred client's well-being, and also to identify and engage potential partner agencies that will collaborate to support the long-range plan for living independently in the community. Implementation. After a relationship has been established with the client and a care plan, including outcome goals, has been developed, the ICAS agency will implement the plan. Case closure. There are several possible ways to close a case in the ICAS program. 1, when the client's needs have been stabilized. 2, when the client transitions to other providers or when the client moves into another setting. Or 3, the client declines further assistance or passes away. Next slide, please. Program requirements continued. The suggested staffing. We're looking for you to have at least a program coordinator or director and case managers. Recommended partnerships. A few of the partnerships we're looking for you to have will be with the Chicago Police Department, excuse me, the Chicago Fire Department, Chicago Department of Housing, Chicago Department of Buildings. Service coordination. DFSS is interested in testing and supporting strategies to improve coordination across service delivery silos to improve outcomes for high needs populations. Next slide, please. The goals, performance goals and outcomes. This is what we will track. DFS will monitor and track a set of performance indicators that may include, but are not limited to, 80% of cases demonstrate risk assessment improvement, reduction on some occasions, score over case interaction. 80% of cases show client situation addressed as outlined in the care plan. And 80% of cases have at least one monthly encounter with the client as dictated by the care plan. Next slide, please. Performance goals and outcomes. To monitor and recognize intermediate progress towards the above performance indicators, DFSS also intends to track output metrics that may include, but are not limited to, 90% of open cases create a care plan. 90% of cases show progress achieved on the care plan. 90% compliance of delegate agency in achieving ECM reporting standards. 90% of cases of reports filed on time as determined by DFSS. Next slide, please. The selection criteria. This is the strength of the proposed program that we are looking for. The respondent clearly defines services to be provided either directly or by leveraging partnerships, linkage agreements with other agencies that are appropriate to addressing needs of and achieving desired outcomes for the target population. The respondent's proposed program is supported by a strong national or local evidence base and/or aligns with best practices for the relevant field. The respondent demonstrates a clear understanding of the target population and their needs and challenges. The respondent has a plan for delivery of services that addresses needs of older adults in general and specific plans for the community region for which they apply. The respondent has an effective approach to supporting referred seniors. Next slide, please. Program performance outcomes and quality. We're looking for the respondent that demonstrates evidence of strong past performance against desired outcome goals and performance matrix and/or other notable accomplishments in providing services to the target population. The respondent has the relevant systems and processes needed to track and report performance on program outcomes. The respondent has experience using data to inform or improve its services or practices. The respondent has the relevant systems and processes needed to collect and store key participant and performance data. Next slide, please. The organizational capacity. The respondent has qualified staff responsible for program oversight and management. The respondent has adequate systems and processes to support monitoring program expenditures and fiscal controls. The respondent has adequate human resources capacity to hire and manage staff. The respondent has expertise working with the target population and has relevant capabilities and/or infrastructure needed to serve this group. The respondent's organization reflects and engages the diverse people of the community it serves. Next slide, please. We're looking for reasonable costs, budget justifications, and leverage of funds. The respondent has the fiscal capacity to implement the proposed program. The respondent leverages other funds and in-kind contributions to support total program and administrative costs. For example, federal, state, foundation, corporate, individual donations. The respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. Next slide, please. The attachments that should be submitted, we're looking for the liability insurance, the board member identification, the SAM certificate, certificate of good standing, bylaws and articles of incorporation, the financial statement, the RRS determination letter, budget forms, CDBG compliance acknowledgement, City of Chicago compliance acknowledgement, conflict of interest, attach resumes and or job descriptions for all staff administering the ICAS program, and a budget for each regional community area served. So for each regional community area that you're submitting your proposal, we are seeking a budget. Next slide, please. Home Delivered Meals Program. At this time, I would like to turn it over to my colleague, Nikki, and she can go into more depth about the HDM RFP.
Thank you, Lisa, and thank you everyone for joining us today and for your interest in serving seniors in the city of Chicago. It is my privilege to talk to you today about home delivered meals. Basically, the program provides nutritious meals to persons 60 years of age or older who are frail and are homebound and have an illness or incapacitating disability or otherwise isolated. This RFP is open to licensed and inspected food service establishments that have prior experience operating a meals program for older adults. The program includes the preparation and delivery of various meal types, which we will discuss, and diets into the senior's home, as well as the coordination and management of client information and enrollment, client activity and status changes, and any associated equipment and supplies for the execution of this RFP. Next slide. So the overall purpose of the program is to promote the general welfare, health, and well-being of older adults by reducing hunger and food insecurity, thus delaying the onset of adverse health conditions that lead to premature residential placement. So the hope is that through the home delivery of meals, we are able to sustain and ensure that individuals are living independently in their own home for as long as possible. The benefits of the home delivered meals program obviously go beyond just serving the meals. They are a safety check every time a delivery is made to the senior's home. It's an opportunity for face-to-face contact for older adults that are enrolled in the program. And certainly it's an opportunity to connect seniors to other services within our senior services programs that are offered through the City of Chicago. Next slide. So part of what we've been seeing within the last couple of years, even before COVID, was that our participation and enrollment in the home delivered meals program was increasing, albeit not at the rate that we observed pursuant to COVID, but certainly there was an increased demand overall. Last year in FY 2020, we served what is an unprecedented number of meals at 4.7 million to over 15,000 distinct clients across the city of Chicago. And we at Senior Services are certainly committed to maintaining the services for our most vulnerable older adults and meeting the increased demand for HDM and hopefully being able to avoid a client waiting list. Some of the areas of improvement for the program for this RFP is to include culturally appropriate, nutritious, and high quality meals to help promote the health and well-being of older adults who are homebound and certainly experiencing food insecurity. So we've added ethnic meal options as specified in the program requirement section of the RFP. Additionally, we are requiring that the home delivered meals provider have and utilize a meal delivery tracking and confirmation system for the purposes of managing route operations and verifying deliveries. Next slide. So from our grantor's perspective, these are the core goals of the program: reducing hunger and food insecurity, reducing isolation of older adults, optimizing the health and well-being of older individuals, and facilitating access to better nutrition, health promotion, and other disease prevention strategies, with the goal of course, as we said, delaying and preventing adverse health conditions that cause seniors to lose their independence. And we want to ensure that this program has a real impact on helping seniors remain in their home and receive the best nutrition that is possible through the home delivered meals program. Next slide, please. So eligibility for the program requires that someone be 60 years of age or older and unable to prepare or obtain meals. While there's no income threshold or cost to the recipients for the meal service, seniors are allowed and encouraged to make a voluntary contribution toward the cost of their meals. And we'll talk about that a little bit later. That is a component of the program. There are two types of referrals for services that come largely through our information and assistance unit. And the referring agencies are typically the care coordination units and the managed care organizations. They are the entities that actually conduct the in-home assessments and determine eligibility for the seniors enrolled in this program. Next slide, thank you. So there are two types of referrals. There's a standard and emergency. Standard referrals are those that really don't have a level of emergency, but given the fact that we're talking about a population that is frail and homebound, we want to make sure that even standard deliveries, the action of enrolling the client into the program takes place as soon as possible, which should be the next business day if it's a hot meal, or the next delivery date for that route assigned if it's a frozen meal. Emergency referrals are those where the client is at imminent risk. And so we have to make sure that even absent an in-home assessment that is done to determine eligibility, that we're able to get the meal to the client that day if necessary, or certainly within that 24-hour time frame, regardless of the meal type. So we're asking that the provider review the information that is submitted in the client referral forms to ensure that the information is complete and that the HDM provider is working directly with the referring agency to conduct any follow-up as needed. You'll see throughout the information that's both in the RFP template and in the supplemental information, the importance of the coordination and collaboration with these referring entities in the success of the home delivered meals program. Next slide. So these are, this is actually the list of the meal program types that we will be offering. All meals must follow the meal pattern developed by IDOA and must conform to the current dietary guidelines for Americans. We have a general diet, which is the vast majority of the meals that we are serving. They will be provided in frozen, cold, and hot meal types. We have a vegetarian diet, which again is offered in frozen, cold, and hot. The kosher meal diet, which is only frozen, pureed, frozen, shelf-stable meals, which are offered throughout the year to seniors to make sure that in the event of an emergency, whether it's an emergency, the senior's part not being able to be home to receive the regular delivery, or something, you know, on a greater scale, weather emergency or other situation that prevents, let's say, the meal provider from being able to get to the client's home at the designated and scheduled time of delivery. And then the two new diet types that we are offering, the Southern Asian diet, which will be in frozen meal form, offers Indian and Pakistani meal options, and the Eastern Asian diet offers a blended menu that includes Chinese, Korean, and Vietnamese meal options. All of the meals listed here, with the exception of vegetarian diet and general diet, will be a 1 meal per unit serving. And we'll talk about that a little bit later. Next slide. Meal packaging requirements. So of course, we want to make sure that the meals are, you know, packaged in accordance with the Chicago Department of Public Health. And we offer a link for the applicants to make sure that they understand what those requirements are. We also indicate in the RFP that the packaging has to be firm and sectioned so that there's, you know, no seepage. And then these are durable trays, and that there is labeling on the actual food items in terms of the date produced and handling instructions for our seniors. And there's additional information that's of course offered in the attachment 9, home delivered meals supplemental information. Next slide, please. Meal delivery protocols. The HDM provider is required to prepare and deliver the complete, freshly prepared meals, ready to eat or frozen prepackaged meals into the client's home. The agency is responsible for delivering the meals to any client, regardless of the address, location, or neighborhood within the city of Chicago. This is a citywide program delivering meals to every area within the city of Chicago. Meal deliveries will be made between the hours of 8 a.m. and 3:30 p.m. Monday through Friday. Of course, weekend routes could be added depending on the growth of the program and the need to accommodate additional delivery routes. Next slide. If the client does not respond, the driver must contact the HDM provider's main office while still at the address of the client to document the situation. The provider must then immediately contact the client by phone to make sure that, you know, the client is not home. If the delivery cannot be made, the driver will leave a notice at the location of where the meal delivery was attempted. Meals must be delivered in oven, freezer, and refrigerator-equipped vehicles. The oven, freezer, and refrigerator units in each vehicle must have continuous temperature monitoring in view of the driver to ensure proper temperature control throughout the delivery. Next slide. Client activity changes, status, and tracking. This is the other piece of the home delivered meals that's extremely important in terms of tracking the status of existing clients, whether it's placing clients on a temporary skip or suspension of service, restarting services, resuming clients, terminations. All of these actions are submitted by not only the care coordination units, MCOs, and the Department of Family and Support Services to the home delivered meals provider, but it could be an action that is observed, a situation that's observed by the home delivered meals provider drivers in terms of the client not being able to continue receiving their meals. All of these actions are tracked and managed for clients on a continuous basis. Additional follow-up is required with the CCUs and MCOs to make sure that there is a proper disposition for clients enrolled in the program, including annual reassessments. There's a short-term program where clients are placed. As we talked about earlier, those are typically the emergency clients where there wasn't a full comprehensive assessment made to determine eligibility, but for which we must ensure that there is a more long-term or imminent action to ensure that the client is placed either in a long-term program or is terminated from the program. And all of these changes are tracked within the client tracking system that we provide for the successful respondent. Next slide. So client engagement and well-being, this is once again that other piece of the program where we want to leverage and take every opportunity to engage and verify the well-being of clients enrolled in the program. So as we expect that the delivery drivers have a consistent delivery route so that these relationships with the client can develop over a period of time. We want to make sure that there are procedures in place that allow clients to be referred for other programs. For example, there could be chores services or respite services if there are caregivers involved that the client might need. So the driver is that critical contact point that is able to observe any and all things that are happening within the client's life and situation, and certainly be able to provide them with the connection to other services that are offered through the Department of Family and Support Services. So a referral can be made on behalf of the client in the designated client tracking system that we will be providing. Next slide. Other components of the program include nutrition education. The HDM provider is responsible for making sure that nutrition education and other informational materials are being provided to the older adults in the program through the delivery process, of course. And it's an opportunity, once again, for the driver to have that conversation with the clients to let them know about the importance of the information that's being provided to them. Voluntary contributions, as we mentioned earlier, this is required by our federal funding. to allow clients the opportunity to make a voluntary contribution toward their meal. It is not required for them to do so, but we must give them the opportunity, and the HDM provider provides them with the envelope and the information on the envelope that directs the client on the mechanism through which they would be providing that contribution. Those contributions are then counted, reconciled, and recorded by the HDM provider and reported to DFSS on a weekly basis as part of the supporting documentation submitted with the weekly billing. Next slide. So client satisfaction surveys, again, one of the requirements from our funder is to have procedures in place for obtaining the views of participants about the services that they receive, and to involve our participants in the planning and operation of the nutrition services that are provided. So we are asking the HDM provider to be a part of the development, the collection and compilation, as well as analysis of these surveys, and forward the results to DFSS. Complaints or grievances, the HDM provider must have written protocol for reviewing, handling, and resolving any complaints from clients or other individuals that we receive. Next slide. As far as staffing requirements, the HDM provider must have sufficient staff for the preparation, delivery, and administrative functions as outlined in this RFP. Staff must possess the appropriate food service sanitation certificates in accordance with state and local public health codes. Delivery drivers are required to receive food handler training, as they are responsible for temperature control and cross-contamination. The HDM provider must have a supervisory structure in place to oversee all aspects of the program. The HDM provider must have a project director for the day-to-day management and administrative functions of the program with a minimum of 3 years of demonstrated management and supervisory experience. Next slide. HDM drivers must have the appropriate driver's license class, insurance, and clean driving record. The drivers must be assigned, as we said earlier, to each route in a manner that maintains consistency for clients. The use of rideshare companies such as Lyft and Uber to deliver meals is not allowed in this RFP. Background check requirements: all respondent staff, consultants, subcontractors, and volunteers, if used, with access to confidential information who have direct or indirect contact or interact with seniors must meet the following requirements: fingerprint criminal background check, FBI, state, and sex offender. For HDM drivers, the Illinois Adult Protective Services APS registry must also be checked. Fingerprint criminal background check is required at the time of hire and every 5 years thereafter. The APS registry must be checked annually. The checks must be completed and cleared prior to hire date. Next slide. This is another component of our RFP with respect to Good Food Procurement Policy Initiative. And this was adopted back in 2017, but it is in our home delivered meals RFP for the first time, as we will be working with the successful respondent to ensure compliance with the city's good food purchasing standards at the mutually determined level of achievement, which will not compromise pricing or number of meals provided. This is a national program that uses the purchasing power of institutional program food procurement to create a healthier and more equitable food system. More information on this is actually also included in the HDM supplemental information document, but our expectation is that the food purchasing requirements will be adhered to, that include signing and submitting the Good Food Purchasing Policy Commitment, submitting annual itemized record of each item, products purchased during the contract period. Items that include product name, unit type purchased, number of units purchased, volume per unit, name and location of each supplier along the supply chain. Total amount of spent for each product to include a price per unit and farm or ranch sourced. Reporting forms to be provided, submitting mutually agreed upon data requests to DFSS, and incorporating the good food procurement policy recommendations when feasible. Next slide. Health and safety compliance. We want the HDM provider to comply with applicable provisions of federal, state, and local laws regarding the safety and sanitation handling of food, equipment, supplies used in the storage, preparation, service, and delivery of meals to older adults. The HDM provider must have a written quality control system which assures the highest possible standards of cleanliness will be maintained in compliance with CDPH codes relative to the facility, as well as the handling, processing, packaging, sorting, and delivery of the food. The facility must meet health and safety regulations and have current health inspection reports available for review. We also ask that the provider secure the services of an independent licensed laboratory quarterly to perform pathogenic organism analysis on at least 4 different frozen meals, 2 different cold meals, and 2 different hot meals on a, as we said, quarterly basis or as requested by DFSS. Next slide. So to track progress toward achieving the outcome goals of this program and assess success, DFSS will monitor a set of performance indicators that may include, but is certainly not limited to, and these are probably looking familiar to you because they were listed as the initial goals of the program. So we want to come full circle and be able to say that, you know, our program, we know our program is making an impact, but here's how we know. 100% of the clients experience reduced hunger and food insecurity due to participation in the program. 95% of clients experience less isolation by interacting with the delivery driver. 90% of clients report the health and well-being as improved. 90% of clients report learning health tips from nutrition education and health promotion materials provided. Next slide. To monitor and recognize intermediate progress toward the performance indicators that we just listed, DFSS also intends to track output metrics that may include, but are not limited to, client tracking and information. 95% or more of the clients listed on the monthly short-term meal program reports receive a disposition. Client is either terminated from the program or transferred to another long-term meal program pursuant to the provider's follow-up with the CCUs and MCOs. And again, care coordination units and managed care organizations are the entities that are responsible for the assessment and initial enrollment of the clients, but also the reassessments that occur annually. 95% or more of the clients listed on the monthly 60-day skip report receive a disposition. Client is either canceled or restarted in the program pursuant to the HDM provider's follow-up with the CCUs and managed care. 100% of the client demographic and assessment data is entered into the client tracking system. This is important information that is required by our federal funder, and any information that is listed on the HDM referral form, which is deemed required, will have to be entered, and follow-up on any missing information is conducted with the CCUs and MCOs, the referring agencies. Food safety. The number of incidents of foodborne illnesses, of course, that should always be 0. Number of quarterly pathogenic organism analysis of food samples reporting positive for Shigella, Salmonella, and Listeria should also be 0. Next slide. Next slide, please. Thank you. Whoa. Okay.
Sorry, did I, this is Tom. Hi, everyone. Is this the correct slide or?
I think there's one before that, maybe.
Oh,
that
one
we didn't
before
go
it?
through.
Okay, I'm sorry about that. Let me go
That's
back.
okay.
This
I
one
just
right
want to
here?
make sure. Right. Food service quality. Yep. Number of instances that food items and condiments provided are not specified on the menus. 85% or more of clients surveyed indicate that they're pleased with the quality of meals and the meal service. Under food delivery, number of meals left outside of the client's home by the driver, number of notices left at the client's residence when delivery was attempted, but client did not answer the door, number of reports of deliveries made outside of the scheduled delivery day or time unless previously authorized by DFSS. 100% of the clients enrolled in the program as immediate need or emergency meals or needing emergency meals receive their meal delivery within the 24 hours of the request. Next slide. Okay. So these are the attachments to be submitted with the application, and please read the application and all of the attachments thoroughly to ensure that when something is being requested, you are providing as comprehensive and complete a response as possible for each item that is being requested or asked, and that any information in terms of attachments or additional information is submitted as well. Please submit copies of your current local health inspection reports and any follow-up reports indicating compliance. Please include a staffing chart that provides the number of line staff, supervisors, and other staff assigned to the project. Please provide the proposed unit rates for the meal types you are providing in the home delivered meals services meal cost proposal. So this actually replaces the need for a budget in the traditional sense that we normally would request from applicants. This is the proposal where we expect that each meal type and each meal type within the meals that are listed are going to be offered and provided, and their respective unit rate costs. There are 9 total attachments to the RFP that we've provided for prospective respondents. Of course, all of them are important and as we said before, should be reviewed. Attachment number 9 provides any additional detail that is important for respondents when completing their application. There is a ton of information that is part of this program delivery, and so it is of utmost importance that this detail is provided, and unfortunately we could not provide all of it within the actual RFP template. So everything that is important for the provider or the prospective applicant to know about how and what requirements are expected to be fulfilled for this program are all listed in the additional attachment, the home delivered meals supplemental information attachment. Okay, I think this is the last slide. Yep, Karen, kicking it back to you.
Hi, this is Julia Talbot. Actually, this is my slide. Is now. So we've got a lot of information. Now I just want to go over the selection and transition timeline for this RFP. This, the CDGA is a huge undertaking for all of us at the DFSS as well as OBM, the Office of Budget and Management. So you are now at the pre-proposal webinar, which is April 19th. 2021. The RFP, the application, will be released on e-procurement on May 3rd at 9 o'clock, and it is due on June 17th at 12 noon. For those of you familiar with the e-procurement system, you will know that we do not accept late applications. The only way that we can accept a late application is to reissue the entire RFPs and make everybody who hadn't applied, who had applied to reapply. And we are very, very loath to do that. Contracts will start for all of these RFPs on January 1st, 2022, and will run for 2 years. We have one sort of change that I wanted to talk about how to submit questions. This year, we really are going with a straighter, have done a lot of work around equity and access. And as a result, we really want to go for a more sort of formalized procurement process than we have in prior years. We're asking that that when you call with questions, we'll be taking questions at this webinar. We'll be answering the questions. And I want to kind of get through my slides as quickly as possible so we can get to that. But we are going to, when you call, if you have a question, you're going to email or you're going to submit it through the e-procurement system, or you're going to call, but we're not going to give you an answer then. We're going to collect all the questions, and then we will periodically be posting FAQ documents onto the DFSS website and onto the individual RFP links in e-procurement. As Karen talked about in the beginning of this presentation, my mantra is save often, submit early. I usually go through a whole spiel about how to do submissions and that kind of stuff. There's plenty of stuff on the internet, on the DFSS website, on the OBM e-procurement training documents. I can happily email you or walk you through some of that process. Just as a general rule, I would say give yourself 30 to 60 minutes to hit submit and do that, and have it go, have it actually submit. OBM has a TA session on Wednesday from 10 to 12, where they're going to go through really the nitty gritty on how to make an application in e-procurement. So if you're unfamiliar, you want a refresher, I highly suggest you go and you actually don't even have to register, you just appear, it's on Zoom. And there are some links to that on the DFSS CDGA website, on the OBM CDGA website. And so let's go on to the next slide and we can kind of get started on that. So as I said, late applications will not be accepted. Any questions concerning program design really need to go through e-procurement, or you can call the person listed in the RFP document, or the program person in the RFP document, or at the end of this webinar, you can call them. They are not going to answer your questions, though. They will record your questions, and then we're going to answer all the questions. All the answers will be released at once so that everybody gets the information at the same time. If you're having issues accessing or managing your e-procurement experience, you need to call, you either can email customer support at cityofchicago.org or make use of the e-procurement hotline or helpline at 312-744-HELP. That line operates from Monday through Friday, 9 to 5. You can also call me or text or email me, and my information is at the end of this webinar and also in the CDGA book. And I can, e-procurement questions we can answer right away. The programmatic stuff is really what we're trying to become, work towards a more equitable way of doing it. So as I mentioned, go to the DFSS website for updates. We're going to be hosting the webinar link there. We're going to be posting our FAQs there. If there's anything you need to know, it will be posted about the DFSS CDGA experience. It's going to be there. Training materials, there's a link there. We're going to be posting this webinar will end up, the webinar link will definitely, from YouTube will definitely be posted on DFSS website. The DFSS CDGA website. And if you just go to the DFSS website, you can kind of click through and get to the CDGA website very easily. Let's go to the next slide. So the one thing I wanted to go through very quickly was how to ask a question in e-procurement. Again, if you don't have an iSupplier account, to ask a question in e-procurement, you'll need an iSupplier account. If you don't have one, go to the e-procurement hotline and contact them, and they will walk you through it. All of the RFPs in our, all of the CDGA things, and actually everything that DFSS puts out can be found at this website. Again, probably doesn't do you a lot of good right now, but this will all be posted. we actually do a lot of RFPs this year, and they're all posted on eProcurement. It's really one-stop shop. What can I say? So let's go to the next slide. So to ask a question in eProcurement, I just kind of want to breeze through this. First, you're going to log into your eProcurement account. You're going to go to that link that was at the bottom of the last slide. It will bring you to here, which is where all of every eProcurement bid is for the whole city is listed. And you're going to hit this login button. So we'll go to the next slide, and you will do your username. You're going to do your password. If you don't remember one of those things, you're going to click Login Assistance, and that will take you to screens where those things can be retrieved. You don't even actually this works really well. I don't forget the username, but I have forgotten my password, and I can say that it was a painless experience to reset it. Next slide. Once you log in, you're going to end up on this screen, and you're going to open the online bidding menu, which you see right here, City of Chicago online bidding. You're going to open up the sourcing menu, which you can't really see because I guess there's a little red, I put a red line through it by mistake. And you're going to go to the sourcing homepage. So click on that sourcing homepage, which will bring you to the next screen. When you go to the sourcing homepage, you're going to have to actually pull up the RFP you want. And this also is going to help you start. This is exactly what you have to do to start an application. So with that, it says, search open solicitations. The quickest way to do that is to know the number of your RFP. It's actually called an RFQ, but RFQ number. And so you're going to set the search open solicitations to number, and then you'll have the number. Look, next slide. So for senior services, these are the RFQ numbers. You would, if you want to do ICAS, you're going to do 7959. You're going to type it in, you're going to hit go, and that's going to pull up the RFP for you to look at. So let's go to the next slide. So that, I've done that here. This is just a test here. So on the right-hand side here, there's an actions button. So here it says, create quote. If you wanted to start an application, you would hit create quote and then hit this go button. But for asking a question, you would go to online discussions, click on that and hit go. The next slide, that will take you to this screen where you would click on new message. New message goes to the next, when you click on that, it will go to the next screen, which says, there you go. So this is where you would write in your subject. I have a question about X, Y, or Z. You would write in your message, and then you would hit send. If you needed to add an attachment, not sure why you would do that in the question, but if you say you were having problems, you wanted to show a screen, right? You could add your attachment there, and then you just press send, and then you're done. So that is very quickly how you're going to answer a question. If you want to do a question in eProcurement, that's very quickly how you're going to do it. I will make sure that just these slides are posted as like a little link on the CDGA website after these webinars are done, and that's kind of it. So let's go to the next slide, and I think this is where I say the applications are due June 17th, 2021, my new favorite day. They're due at 12 o'clock noon. Do yourself a favor. The system has not crashed in three or 4 years that I've been working with it. Doesn't mean it loves your computer though. So do this stuff early. This is going to be a lot of people, lot of people, hundreds of people are going to be making an application at June 17th, 2021 the department has 23 RFPs. There's 4 or 5 other departments that have not as many, but still a significant number of RFPs. There's going to be a lot of people pressing send. It's not going to be the greatest time for you to call that OBM hotline and think that you're going to get through, or that somebody's going to really be able to help you with like a complex problem. You can call me, but at the same time, I got 23 other RFPs I'm doing. So give yourself a break. Try to do this early. Give yourself time so that you can get through. You can get the help you need. There's a lot of people out here that can help you with this, but there's also a lot of people applying for this. And so we hate to see people lose out on an opportunity. We love reading applications. We're always so thrilled when people decide to apply for our stuff, but this is going to be a crowded one. And so give yourself time to do the job, to do a good job and to get your stuff in early. and to have this be a more relaxed experience than it will be for probably anybody at DFSS. So moving on, I think that we're at a point now where we can open it up for questions. I see there were kind of a few questions here. I'm going to start with the first one, and this is where I'll read the questions, and Karen or Lisa or Nikki or whomever, you chime in with the answer. So the first question here is, can you confirm that DFSS will provide the well-being assessment that delegate agencies will use? Assume you don't want delegates all coming up with their own assessments. So this is definitely, I believe, a CAS or ICAS question.
Okay, the question was, will we be providing the assessments? What we're going to be doing is we're going to collaborate with you. We're going to provide you with what you need in terms of helping to assist you develop the care plan with the client. For CAS, you will be, that's the delegate agency that will initially make the initial visit to the client. So let's say, for instance, Miss Jones. A neighbor of Miss Jones happens to see her and she's losing weight. So the CAS respondent will go out and maybe making that initial visit to see Miss Jones. That's what that respondent will be responsible for. An assessment, we will be providing the assessment for CAS and ICAS. So once the respondent goes out for CAS, which is case advocacy and support, to see Ms. Jones, I'm going to just give you a high-level synopsis. They will then report back to DFSS their findings. At that time, the intensive case advocacy and support, the ICAS delegate agency, that's the respondent for that RFP. They will then be activated and they will go out to make their assessment. They will be meeting one-on-one with the senior. They will talk to Ms. Jones. They're going to find out what Ms. Jones needs. They may talk to Ms. Jones and find out that Ms. Jones hasn't been cooking. She doesn't really have the money for food. Ms. Jones may, because of her money situation, she says she wants to file bankruptcy. They'll have that assessment in hand with them, which will then activate the home delivered meals. That's where that RFP, that respondent, comes into play. And we also have legal services. We'll educate you more about the additional services that we provide to help provide you with the tools that you need as an ICAS delegate agency. So that kind of gives you an oversight to touch on each RFP that we've gone over today. We have, in looking back at the map, we have gone through an extensive research to determine the regional areas to make sure that there is it's very equitably done.
Excuse me, Lisa?
Yes.
This is Karen. Sorry, I think Julia needs to read the questions. I could be wrong, but just to confirm, so for ICAS and for CAS, as Lisa said, we are working between now and the end of the year to revise the assessment tool. The assessment tool will be put into the ECM, which is how our assessments are entered, and they will be uniform across agencies for the ICAS program. And for CAS, we're working with the provider agency to refine that tool as well. I think that answers the question. And then, Julia, can you read the next question, please?
Oh, I was muted. What do you define as qualified staff? Do agencies need to have staff with certain degrees? Lisa?
Sorry, I was muted. If the RFP that you're responding to indicates that a degree is warranted, then I would send resumes listing that the degree is warranted.
Okay. Great. What is the expected caseload for delegate agencies implementing ICAS?
That would be contingent on the area that you will be serving. Each area may have a different expectation of clients that they'll be serving, but we're making sure that it's very equitable depending on the region that you're serving.
And that would be something, this is Karen, that would be something that the respondent would want to put in their RFP. They would want to say, we would like to serve region 3. This is how many clients we think we'll serve, etc. So that would be a part that you also would target in your goals for your RFP.
Yeah. Oh, here's a good one. So how many delegates will be selected for each region?
There will be 1 delegate agency per region. That's why we've gone into such a high length to make sure that we looked at clients that were 55 age and older. We're trying to make it much better for the delegate agency so that they won't spend a lot of time traveling all across the city. We've met with previous delegate agencies in the past, and we've listened to their concerns, and we've modified this RFP accordingly. So therefore, we're breaking it down into regions. That's why I was getting to with a regional map, so that's more conducive to the client and the respondent.
Great answer, Lisa. And just to kind of add to that, this is Karen again. So when we determined the areas, we looked at the number of people aged 55 and better in each community area. We looked at the incidence of poverty in individuals aged 55 and better. We looked at the ICAS frequency for both 2020 and 2021. And maybe if we could go to the slide with the map on it, Julie, I believe there was a question on that slide. And the other thing that we looked at also was the interaction of the poverty of people aged 55 and better with the frequency of ICAS cases. So we really tried to pull apart. And as Lisa said, we had a lot of conversations with delegate agencies who said it's hard to get from, North Center down to Roseland. And it's hard to develop networks in all of these different areas. And so really what we're hoping is that for a more truncated area, that the delegate agencies are able to play a role in really growing and developing the supportive programs that they have for older adults.
And
so I see here that Thomas pulled up the map. So there was a question about, can you explain the map colors and
Sure.
what does white mean?
Okay, so this is the 2021 frequency here. The blue is the region, and then white is 0. And now this, keep in mind, this is 2021, and we ran this map in, early April 2021. So you can see there are certain areas that have no incidents, and then there are some that have many incidents, and this would be 7 incidents or more in this area. So we also looked for this, for these areas, we looked at areas greatly impacted by COVID as well. I forgot to mention that, I apologize. So we really looked at a variety of factors and tried to really thoughtfully figure what the regions would be that were practical.
Great. So here's a question. We are currently a congregate meals provider providing Korean hot meals. Would it be possible to be an HDM provider to provide ethnic hot, not frozen meals? So I guess this person is interested in just doing the hot meals, not the frozen meals. Nikki.
Thanks, Julia. Yeah, so the RFP specifies that the meal type for the culturally specific meal cuisine that we're offering will be frozen. And we are looking for 1 successful respondent to provide the services citywide within all of the meal types and categories that we've described in the RFP.
Great. Okay, and then here's another question, I believe, back to for ICAS or CAS, once the provider is selected, how are referrals sent from DFSS to the provider, or is that sent from the MCO?
That will be, you will receive the referrals from our ECM system. We have a system in place where the CAS agency, they will input data that will come to DFSS, and a determination will be made what area gets that referral. So it's wherever the referral originates from your region, you will get that referral.
Great. So these are the questions that we have. I'm looking to see if there are other questions that have been that people have. I here we go. Is the DFSS ECM same as Department of Housing's ECM? So that's the Enterprise Case Management System. And my impression is that my understanding is that it is, but I don't, that is, does anybody know that for certain?
I cannot confirm or deny.
This is Karen. The ECM system refers to, I believe, electronic case management. And so while it's the same system, it's not the same, it's the same platform, but it's not the same system, if that makes sense. So the ECM system for the ICAS and CAS programs is designed, it is a closed case management system where only the delegate agencies can see their cases. We can see as DFSS the cases, and the delegate agency can see them. Nobody can see across them except for DFSS. And the CAS also will input their data in the ECM system. And we're working on a system that will kind of streamline that process. So it will auto-populate some of the domains of the assessment tool directly into the ICAS provider's site. And then there will be a notification, as Lisa said. Although sometimes we may call you if there's something urgent.
Okay, thank you. So let's see if there are any more questions. Again, if you have questions after this webinar, you can call and email and submit them through eProcurement. They will be answered we'll be posting amendments with the FAQs, posting the answers on the DFSS website. Okay, so to clarify, if an agency wishes to provide ethnically and culturally appropriate meals to Asian seniors, they must be frozen meals. So, Nikki, unmute.
Oh, so sorry. Yes. Currently, that is the meal type that we are offering within this program. It is frozen.
Okay, so only frozen meals.
And Julia, this is Karen. I'm sorry, I don't see Nikki's information on this slide. Shall I put it in the chat?
Yes, and Nikki's information could be put in the chat. And also, when you if you look in the CDGA program book, which was released last week, Nikki's information is in the HDM program, in the program book under HDM, so that you can get her information there.
Super.
So let's see if there are other questions. Please answer them now, or ask them rather, or you could answer them, I suppose. But you know. I wouldn't mind that. You know, you can just answer. Great. So if there are no other questions, then I think that we'll conclude the webinar. We'll thank you for attending. I'm very excited about these new programs, you know, but that new programs sometimes a little hard to wrap your head around. So do reach out to us. We're looking very much forward to reading up your applications and submissions. Remember, start early, save often. submit early. You know, if you have questions or you want to go to that OBM TA session, it's on Wednesday, April 21st from 10 to 12. They had one this morning I attended, and it was, you know, it was very thorough, very informational, and a great place to get your questions answered, you know, in real time. So if that is all, then I'm going to wish you guys a great rest of your days. Get started on your applications right now while the information is still fresh. And yeah, we look forward to seeing your submissions. Thank you.
Thank you, everyone. Thank you,
everyone.